Thank you. Absolute pleasure to be here talking to all of you. Thank you, Dr. Anurag Batra, for that very insightful talk, and you set the tone for BW Healthcare Festival of Health Tech 2023. On the subject of books, I think my self-awareness journey on health probably started by reading books on health, and far away from gadgets, the book by Hacking Health, Mukesh Bansal, he just says three things. He says, if you do these three things, you don't need to read my book. And that is the disclaimer in the very first few pages of the book. And he says the point that Dr. Anurag Batra had made, the first one, sleep more, which is well covered. And then he says, eat less. And lastly, he says, always move. He says, if you do these three things, then you don't need to read my book or wear any gadgets, or really don't have to go too many times to a doctor. I think that is something which, if most of us imbibe, would really be useful, because I, as part of the Commissionerate of Health, Government of Karnataka, I see that our country, while it is going to produce brilliant leaders, we're going to be the financial capital of the world probably in the years, but the healthcare burden is going to hit this country very hard in the next 20 years, because we are seeing young people burdened with what we call NCDs, non-communicable diseases. Today, COVID apart, communicable diseases are no longer our concern or worry. Our concern remains non-communicable diseases, BP, hypertension, and diabetes, cancer. And this burden is only going to rise as we see younger populations getting affected by it, and most of which can be avoided, most of which can be easily reversed if we adopt lifestyle changes. And even before I start my keynote address, I wanted to share this concern with all of you. So thank you again for allowing me to present the keynote address. I think the topic, Vision for Healthcare Advances, is very apt today with multiple technologies, applications hitting us. Probably in an era where information flows much faster than ever, where technology evolves at a highly unprecedented rate, and where understanding of the human body and mind deepens day by day, we find ourselves probably at the cusp of a healthcare revolution. And these are exciting times. This revolution is, however, not driven entirely by new gadgets or groundbreaking treatment, but something which is far more profound. And that is probably the power of insight, the power of prediction, the power of knowing what is the need of the hour in the coming days. Inside, my friends, is a key that unlocks the doors to progress in healthcare. It is probably an ability to see beyond the surface, to comprehend the intricate web of factors that influence our well-being. As we gather here today, we also witness the convergence of technology, data, and most importantly, I think it was talked about in the earlier session, human compassion and kindness, because at the core of healthcare is eventually this. Let it not be only into the technical aspects and the technology related aspects. The tools of artificial intelligence, big data analytics, advanced medical imaging, I mean, these are nothing short of extraordinary. These tools were not available, say, 10 years back. But I think having these would really empower us to extract meaningful insights from the mountains of information that we have today before us. This helps us with much more accurate diagnosis, early screening, new therapies which are at the horizon, which we can tap into, and helps policymakers like me to probably design much more equitable healthcare interventions on the ground. Let us not forget, while technology and data provide the canvas, as I said, it is human empathy, curiosity, dedication that paint healthcare advancement. Behind every data point, every line of code, there is a person with a vision, as I'm sure all of you here are, and those who are going to get awarded. The vision of a happier, healthier, and a more prosperous world. As I said, day by day, we are discovering that more ailments, diseases are hitting us. Communicable also, the challenge is tremendous today. We are looking at, we're just off the cusp of COVID. We've been hit by a round of dengue infections, children as young as 6 months old up to adults getting infected. We have the huge challenge of Nipah, which is probably hit us the second time in Kerala. And we really don't understand these viruses. We don't understand how really these transmissions take place from animals to humans. So the whole concept of One Health, where we do not look human health in isolation. We have talked about climate change. So it's about human health, it's about animal health, and it is about the environment and the climatic changes. So in One Health concept probably lies the future of healthcare, because today, in the days to follow, we're going to have a lot of zoonotic diseases getting transmitted onto humans. And healthcare is going to face tremendous challenges in not finding adequate treatments, vaccines apart. We are far away from that. But let us say even supportive treatments are going to be a challenge. So I would like to flag that to this esteemed audience here. The other challenges that lie ahead, yes, of course, ethical dilemmas, because there's going to be a lot of data floating around. We saw some of those images, applications. People are going to question, where is this data going to reside? How is my data going to be kept safe? Is it going to be compromised? So that is something which all of you need to be aware of. I handle the national program of Ayushman Bharat digital mission, which is basically a one-stop effort of the government of India and the state to converge all digital efforts together. Recently, you must have seen that the Parliament has passed the Digital Personal Data Protection Act. I would urge all of you to read the text of that and do not compromise on patient data security, because this is extremely private data of patients, which is out there for you to actually use it in unethical ways if somebody wishes so. But this is something which I would urge all of you to have strong systems in place, align yourself with the Data Protection Act that is in place today. And while a lot of anonymized data can be used for analysis with the consent of the users and the patients, but anything which is not in synchronization with the act, I would strongly advise you not to go there. We also have the universal health coverage today. We have the Ayushman Bharat Arogya Karnataka scheme, which we do to cover a fair number of our poor population, where some kind of a medical assurance is given up to 5 lakhs. Annually to a BPL family, and up to 1.5 lakhs annually to a above poverty line family. So these are again steps which we are pushing and trying to get in a lot of treatments, lot of newer technologies, newer treatment modes into the ambit, so that not only the have-to-dos avail from these benefits, but even the have-nots can access this. So as we embark on this journey of the future of healthcare, I wish BW Healthcare and this Festival of Health Tech 2023, the inaugural festival, to be of tremendous success, and may it help us bridge the gap of ensuring that healthcare truly becomes universal, it truly becomes accessible, it becomes affordable, and it really bridges the gap and makes us understand that what is really essential in today's world to be healthy and be a contributor to this nation, which is going from strength to strength. And each one of us has this responsibility upon us to speak about health and wellness, because that is the new concept. We don't talk about cure, treatment, because we really don't want you to get there. The whole concept is about health and wellness today, that how do we ensure that our diets are good, that our exercise regimens are good, and that our sleep patterns are good, and also how we keep away from anything that is impeding our health and growth. So I think each one of you here sitting here is going to be an ambassador in this area, and do feel free to collaborate with government in whatever initiatives you feel can further this goal. And we are here to join hands and ensure that we reach this goal of health and wellness. I once again thank the organizers for having invited me here to address this esteemed panel of members. And I wish the Festival of Healthcare 2023 all the very best. Thank you.